Meeting to order. First thing we need is a motion to approve the minutes of the prior committee meeting. Supervisor McDevitt, seconded by Supervisor Molino. All those in favor? Aye. Opposed? Carried. Okay, is there any privilege of the floor? Mr. Lehman, was there any comments or anything?
We do not have anything on the agenda as of now.
Okay, hearing that, we'll move right into our action agenda. Item number 1, request items to be discussed by the county administrator.
Thank you, Mr. Chairman. The policy that is on here is the Warren County Workforce Violence Prevention Plan and Program. And the change is going to be on page 19 of the policy, which is, if you scroll through your packet, you'll see, just trying to show you where the red is, but there's a little bit of red before you get there. Go past the first section that has the red comments on it. It's under C. So at the top of the page will say A, timing of investigations, and then so the section we're talking about is C, notification to the reporting party, accused party, and the personnel committee. We're going to have changes over in Jackie's agenda that mirror these on the discrimination policy. And when you think about these policies, there's 3 parties, at least the way I think about them. There's the party that made the accusations, the party that was accused, and also the employer. And we've seen from all 3 of those points of view that there are improvements that could be made in this policy in terms of information sharing. So this is an attempt to do that. So what we're saying is that when there's an investigation of an accusation that's made pursuant to the workplace violence policy, if the investigation finds that there was actually something that happened that violated the policy, that there's a mandated requirement now to report that out to the personnel committee. Personnel committee, it has jurisdiction over both of these policies, and in the case of the discrimination policy, it's the appeals board. If there's a determination made by the compliance officers on the discrimination policy, the appeal comes to the personnel committee. From that perspective, it makes sense that you would have this information anyway. But from an awareness perspective, from the perspective of those that make complaints under these policies, it's been pointed out to us that the employer, being the board of supervisors, doesn't always necessarily have a full appreciation for complaints that have been made in the past that lead to a conclusion that somebody did something wrong. So in bringing the personnel committee into the loop, it addresses the accuser's concerns that, if somebody is a repeat offender, that the employer have full knowledge of that. Also, from the perspective of the person who is accused of the wrongdoing, the sensitivity has been, well, anybody can make an accusation and it doesn't always bear fruit. So it's unfair for innuendos to be out there about how many accusations might be in a file somewhere. So by bringing any findings of wrongdoing back to the personnel committee, now it's going to give us a situation where if the personnel committee hasn't heard about findings that came out of a complaint, then that means there were no findings that came out of a complaint. So you have a better perspective now on the accused as to whether, if we think there was an issue, you're going to know about it. And finally, from the third perspective, being the employer, you have an obligation to provide a safe workplace, free of workplace violence and free of harassment. And we thought that this, again, was a piece that was missing in your ability to do that, to have all the information. So those were the reasons for proposing the change. And I can take any questions if anybody has them.
Supervisor Seaver.
Thank you. County Administrator Moore, I really appreciate the amendment to this policy. I think it's critical. I do have 2 questions, however. One, would it be appropriate to put a time frame in that language, saying within 60 days of the findings that would be reported, or within, at the next committee meeting? some type of a time frame that would, things get busy, of course, and sometimes it can be several meetings. I think given the serious nature of both of the findings, it would be appropriate to say, within 30 days or within 60 days.
We could do that. We thought about putting that in a draft, and sometimes these complaints end up in law enforcement, especially the workplace violence ones. They end up getting investigated by law enforcement. So that was one thing that we kicked in our mind as to why we might not want to put something in writing that it's got to be 30 days or 60 days, because maybe there's a reason based on a law enforcement investigation where we would find something that we thought was wrong, and then it would get kicked over to law enforcement, and they would want a cut period of confidentiality for them to conclude an investigation of their own. Because sometimes these originate here, we find that there's merit to it, and then we send it over, and there's a process over there. It would be my intention, certainly, to bring anything back to the next personnel committee after we found that something happened. Whether or not we want to memorialize that and maybe put an exception in there in the event that law enforcement wanted us to delay.
I mean, given the fact it would be updated in executive session, to me, then that would address the confidentiality issue, or perhaps that exception to the rule, but something in there, because while it's your intent, that's great. I just think that when we're looking down the road, with a policy like this was just, changed last year, and the one before that we had for quite some time. I just think for consistency and as an organizational document, it might be helpful. But my other question was also the results of investigation versus the findings of wrongdoing. The individual that filed in a complaint or the accused party and the accused party, they're notified of the results one way or the other. Is that correct?
Absolutely.
Okay. And then personnel committee would only be notified, like you said, if in fact there was.
Right, because if an investigation is being done properly, somebody who's the subject of a complaint is going to know about it, whether or not the complaint has any merit, because you bring them in, you get their side.
No, I understood. I just wasn't sure.
Yeah. So that would be so they will, if once you bring them in and you question them about a complaint that's been made against them, it's decency to let them know how it turned out. And from the perspective of the personnel committee, we would limit that to, you're not going to hear about every complaint that comes in, and in the event that some of the complaints are not merited, we don't want to tarnish anybody's reputation in your eyes that when it's not deserved. But that was the logic behind that.
No, I think that's a good clarification. I just, as it relates to both those notifications to the accused and the person filing and to the personnel committee, I would think that something of a time frame would be reasonable, but that's just my opinion.
Well, do we want to say within 60 days unless law enforcement has an objection? I have no problem with that. That we would be complying with that anyway.
But I'm not on the committee, so I can't make that motion to amend your language.
Supervisor Bramer, are you making a
I'll
motion?
bring that as a motion to amend if we need to do such a thing. I don't know that we need to make a motion to amend. If we can just add that to the policy before it comes to the full board.
I'm not sure if we had a motion to discuss, so I mean, you could make a motion to include that language in it. I don't know.
Okay, all right, yeah, I'll make a motion then to approve the amendments as revised, adding the 60-day time frame with an exception due to law enforcement.
Jackie, does that work from your perspective?
Good morning. Yeah, that one, I don't know that they're always finished with the legal process. So as you said, as long as there's the exception for people who face legal charges but don't have a resolution on that end, we could report that it's simply been referred to law enforcement, and then the committee's aware that it's happening. But once it's part of the legal system, it's obviously out of our control.
That's a good point. We could always the update could be that there's been a referral.
Thank you.
Okay, do we have a second? Do we have a second from Supervisor Merlino? Any further discussion?
one more time. Sure. So it'll be, I read the change title. The change title wouldn't change. In the paragraph, the new paragraph would be, the results of the investigation shall be communicated in writing to both the person filing the complaint and the accused party. Findings of wrongdoing resulting from such investigation will be reported to the Personnel Committee in executive session within 60 days, provided there's not a, well, we can wordsmith it, provided there's not a law enforcement reason to delay reporting of the details.
Okay, if there's no further discussion, I'll call the question. All those in favor? Aye. Opposed? Carried. Thank you.
Thank you, sir.
Okay, item number 2, items request to be discussed by the Human Resources Director and/or Personnel Officer. We have first the health insurance renewal with Yeager and Flynn. We have
All right.
Matt here. Good morning, Matt.
Morning. How's everybody doing?
Doing well.
All right, so I'm trying, I'm trying to share my screen and it's not enabling me at the moment.
You should be able to now.
Oh, I think I'm getting there. Okay. All right, can everybody see that? I see some shaking of heads. Okay.
Take that,
All right.
we'll hit the way.
So I'll go ahead and again, it's good to see everybody. See everybody. So we're at the time of year where obviously we're going to be reviewing the renewal. We just met with the working group last Friday to review the healthcare options. What the renewal is looking like. And if some of you have seen this, I think you'll agree. We have fantastic news to share. As we're going through this, and I'm going to drill down a little bit. I mean, obviously, with this, as far as I'll take questions at any point. I will pause it a few times and just to open it up. But I'll go ahead and go through it. But we've gone. I guess the process I want to just remind everybody of is we are aiming to have open enrollment because we want to give people enough time to make their decisions, of course, sometime really mid that week of October 12th or so. So working group meeting was last Friday, and then obviously we have this committee meeting and then Board of Supervisors meeting in a few weeks to keep that process moving. So we have it in September, so it's ready to go for October. But I'll go ahead now and jump into the actual renewal. If you've seen this in the packet, if you had an opportunity, we're very fortunate this year for a number of reasons. Your renewal, if you're looking, these are the premium equivalents, and there's key language. It's technically not wrapped up yet, but you will see as this comes along, it's not to exceed these premium equivalents. There's certain things that we're still waiting to get wrapped up, such as the reinsurance. The reinsurance policy referred to as stop loss sometimes. That is Blue Shield will not bind that until you get within 60 days or so, sometimes 45. So that gets us into October. But we're starting to see that come together. As a reminder, today your reinsurance, you're self-insured obviously, and your reinsurance level kicks in once a member hits $100,000 of medical or prescription spend, all claim dollars combined. And I'll reflect on the year a little bit. I mean, we're comfortable for a number of reasons keeping your premium equivalents with zero increase. So that's your base level, no change to the premium equivalents, which is fantastic. We don't have, there's again not a ton out there that are going through this as far as changes are concerned. But I want to give you some reasons in the background of and just some idea of what the plan to keep in mind. Just as a reminder, there's no copay changes, no deductibles, no plan changes going on in the background to achieve that. So the members, whatever their copay is today, it would be that as of December or January. There's no changes going on there. We did early on in the year, you may recall last fall, we were talking about evaluating Blue Shield as your network partner. And, you know, which partner was the best network, which network has the best discounts in a given region. And it was determined early on in the year, we were in January, February timeframe, that Blue Shield was still the best partner on the medical side for Warren County. So stability going into this year, no changes to the plans. I will say, you know, obviously in the background here, obviously we've had a heck of a year, all carriers have with COVID claims. And we did see your claims. We have seen some employers, their claim spend, their utilization due to COVID or through those 4 months were significantly lower. Blue Shield's claim spend did go down a little bit for those months, but at a lower pace than some others. But let's face it, I mean, the lower claim costs due to lack of people using it really during those months is helping to some degree getting us to this 0%. Expectations of those claims coming back, some will, some won't. The time periods are a little bit of an unknown. The industry has factored those claims coming back over the next 18 to 24 months. But again, where we're comfortable with this, and it ties into the conversation that we're going to have, you're reserved properly. We're starting to see trends over the period that you've been self-insured. And, you know, we're comfortable having you at a no cost increase, no increase to the premium equivalents, you know, for the December 1st plan year. With that too, and then I'll pause for questions for a minute, but with that, this is the year we are recommending a change. We've talked about this for a number of years. When we first went from fully insured to self-insured, we actually lowered your overall risk from what Blue Shield had you at to $100,000 per member, if you can see me highlighting this now. This recommendation this year is to move it to $115,000, which is not really a significant bump. What we saved in our fixed costs. We're saving in the premium that Blue Shield is charging for that. And, you know, the ratio where you're taking on $15,000 more of liability per member, but you don't have a tremendous amount of members that are expected to cross over that amount going into the next year. So we feel this is a year to do it, and that savings also helps us with, you know, keeping your premium equivalents at that 0% increase. Last thing, on the medical side, I'll just observe before we move over to the prescriptions is there's two things, and I know these terms become synonymous, but there's two components here. Your telehealth utilization has just exponentially grown. So telehealth is where your membership, where employees see their own doctor. Hudson Headwaters, Iron Gate, like that. And I say seeing, you're using your phone, your device, your laptop to see your own provider. I'll just give you a quick example. In February, pre-COVID, you had 3 members do that. In March, you had 99. April, 329. May, 291. So that, for obvious reasons, that utilization has really, really jumped up. And the telemedicine itself, so there's two components. Telehealth is where you're seeing your own doctor virtually. Telemedicine is where you're still seeing a doctor virtually, but it's not your own provider. It's one of Blue Shield's doctors on demand. And that utilization hasn't changed a ton. But I think it's exciting to see to the degree that your employees are able to do it, are using it, and have had success with it in large fashion. So that, you know, over time, I think is a good thing. And we can talk about, you know, which one costs more and you know, cost containment over time with that as well. But I'll pause there for any questions on the medical side of it before we transition a little bit over to prescriptions. Okay, good for now. On the prescription side, same thing. As far as when no changes to copays or deductibles are being implemented, we do have a new prescription contract that's been negotiated that's also going into effect at your December renewal. That is going to continue. We are constantly looking at the prescription contract and methods to reduce costs there, because on the prescription side, that is where are your overall health costs. A lot of it is coming from prescriptions, and particularly specialty prescriptions. So there's a greater contract negotiated with Blue Shield going into effect December 1st. Going to, have big savings coming back, generated back to the county. Again, no copay changes and very minimal formulary changes. And formulary changes happen all the time in the background anyway, where they move drugs from one category to the other. On the prescription side also, we have, you may recall, we installed a Save on Rx program, which that's to take advantage of coupons, manufacturer coupons. And I will just note that is freeing up a lot of money that's coming back to the county. It's benefiting your employees, it's benefiting the county. And if you want something to kind of remember or trigger it by, the next time you're watching a commercial for a prescription, listen to the very end where they say, if you need help paying for this prescription, you've probably all seen those. That's what this is. We're taking advantage of that manufacturer's money that's sitting out there that used to just disappear. Now the member gets a part of it, and you're getting a chunk of it to offset your cost. No, win-win for both parties, and that's freeing up. That's another reason overall we're gaining savings wherever we can. That's another reason we're able to, taking these steps to keep these costs down, at that no cost level. No increase, I should say. I'll move on to the Medicare side. I mean, for the most part, as I mentioned, really on all parts of it, this is a very favorable renewal, very favorable meeting, and I'm happy to be talking about it. Your Medicare Advantage with Humana, that is going into effect January 1st. All your Medicare plans renew January. And you've probably, if you've looked already, it's a very favorable renewal. In this case, the lack of claims, Humana is really passing that back through. There's been a significant decrease. You'll work it out internally how to do it. We did communicate it to the working group. The base rate is going to be $197. I'm going to just turn the page so you can see it. On the Humana side, today, this is today's current rate of $207. Due to COVID, and I'm going to just call it a COVID credit that they're giving you, the rate is really going down to $165. It's a 20% decrease. Where I said that number before of 197, Humana is considering this a aberration, a one-time claim dip, and they are going to be basing next year's renewal calculation on $197. So we communicated that, to finance, and you'll figure out how to budget that internally. But in either case, this is a significant help. And by all accounts, from everybody that we've heard from, out of 486 retirees and spouses, the feedback from Humana and just the last few years of them, the experience of them has been fantastic. So again, all great news there. And I'll just hold there for any questions.
Mr. Chairman, may I?
Sure.
Matt, this is the first decline I think I have seen in the supplement, any supplement program in a decade. I can't recall. I mean, as a percent of increase, this has been going off like a rocket ship. Now, the dollars may be less than a full-blown policy, but the rate of increase over the last 10 years has been phenomenal. This is a tremendous thing. Can you recall any significant decrease like this in the last?
Not like this, Ron. This is the Humana plan by itself before COVID probably would have had a very small decrease. It probably would have gone down 3 or 4%, which by itself is really unprecedented. It's performed since inception. The amount of savings that this plan has passed back to the county, it has been amazing. And, what's really driving this down to that 20%, like I said, it would have been a couple percentage points to 20%, is they are passing on all of that lack of claims, all that good experience that nobody could get surgeries in April and June, May, as an example. They are not looking to take advantage of it, really, is my take on it. And they're passing those claim savings back through in this credit, COVID credit, as I'll call it. That's not an actual thing, by the way. That's just, I'm making up a term. But they're passing back that the lack of claims back to the county. So this is, no, I agree with you. It's very, very favorable. Very favorable. Okay, again, I'll pause, before we wrap up, because we can jump back and forth to any of these at any point. I'm going to go, some of these are very simple from this stage. Delta Dental, this, you already don't have any budgetary impact to this because your contributions are locked in. The costs are not changing, zero change to the premiums. One thing that we didn't get a chance to communicate that is a new, new item for Delta Dental. They are going to be providing a credit for the 25% credit for the months of August and September. Again, carriers are not looking to, at least optically, take advantage of this lack of claims. So for August and September, there's going to be a 25% credit applied after renewal. Companies have to renew. So that's, again, a very positive thing, passing back some of the savings that they've experienced on the dental side. But no change to the employees, no change to their cost, no change to the benefits, and ditto on the vision. Again, this is employee paid. Employees pay this, and his vision plans are very, very affordable, but you have 453 enrollees, which is just fantastic. And the plans provide excellent benefit, and there's stability. No changes to the benefits, no changes to the rates. And same thing, you recall we introduced last year a voluntary life and accident plan. We had tremendous uptake on it. I think employees were very happy to have a menu of plans at their disposal. And a lot of people took advantage of that, and there's no changes to the base rates on those either. So I hope you all just remember all this good news. Someday I may not have all this good news, but right now it's just all good news. This is great. The next thing I want to go over, we're introducing this year a new critical illness plan. Now, I want to just preface this too. This is the same. There's no impact to Warren County, no impact to the budget, no cost. This is the keyword, voluntary. We're enhancing the menu that employees have to choose from of a plan. And they're on the employee navigator where they make their electronic elections. They're just going to decide, yes, I want it, or no, I don't. And either answer is fine. Whatever they decide, you're providing them, option to choose them a higher level of really just a complete benefit portfolio. And the critical illness plans, this is also through Guardian. This is Guardian, so you have your life and your accident plan through. These have evolved. Some of these you may have heard in the past of cancer plans that are just, and cancer plans are just very specific, obviously, to that one condition. A critical illness plan is much more comprehensive in that it covers, of course, it covers cancer. And I should state first, to say the obvious, your health plan certainly covers cancer. Your Blue Shield obviously covers cancer and heart attacks and end-stage renal. With that said, employees that have cancer or, had some of these issues happen, your copays tend to add up, hospitalizations add up, there's travel involved. And these critical illness plans provide lump sum benefits. Employee can get $10,000, spouse $5,000, children $2,500 if they have not just cancer, but any of these, end-stage renal, heart attack, stroke, carcinoma, invasive cancer, skin cancer, as an example. It's much more comprehensive. And there's a wellness benefit that's on it. Somebody that's in the middle of care, there's a pre-existing window that they wouldn't be able to have coverage immediately, right away. There's a 6-month wait for somebody right in the middle of care, or within the last 6 months, I should say. But, beyond that, their rates are here. We're happy to be able to just continue to give people options if they want to choose from it. There's no real minimums. We have 5-person minimum could take it. So it's not like we have to, hit 100 threshold of employees to take it or not. It's a very good plan that a lot of employees like, and again, rounding out your benefit package. So I'll stop there on any of these 3 pages that you want to ask questions. I'm happy to entertain any at this stage.
Mr. Chairman?
Sure, Supervisor Conover.
Yeah, I just think, with all of the financial bad news that municipalities and counties have been receiving across the board as a result of this pandemic, I have to say, I'd like to take this moment just to say to Yeager Flynn, to Jackie, Ryan, and the whole team that work on these programs, that this is really good news, and thank you all for your excellent work and efforts in this regard. This couldn't have come at a better time. As you know, our total healthcare cost is a very large number. Something like was 12, 13 million, something that order of magnitude. And so every 1% increase in our healthcare costs is a big number. And so to have it unchanged for next year, that's certainly good news. And to have it actually go down for our retirees. I mean, some of our retirees, being on fixed income, having a 20% reduction in the premium. I mean, I haven't done the numbers, but I think you could easily be talking about a decline of over $100 per retiree. That 20% could represent that amount, and that's significant when you're in retirement. And of course, for us as the employer, we would be 2 or 3 times that, right? So, congratulations. Thank you.
Thank you.
Is there anybody else that has any comments or questions?
So now,
Oop. I guess Siri had a question. I can't see if anybody.
Does Siri-
That was me.
Does Siri do budgets, Matt?
Let's ask it. Look at yours.
I don't see any.
Okay, well, thank you, Matt.
Absolutely. Thank you all. And okay, I'm good to go. Thanks, guys.
Thank you.
Thanks, everyone.
Thanks, Kurt. Okay, we'll move on to B, review of report on tracking of vacancies filled. Reports in your packets. Not sure if anybody has any questions on that. Not seeing any. Okay, also attached in your packet, there's an update on any terminations or exit interviews that have been conducted. I don't know if anybody, I don't see any comments or questions on that.
I'll add something to
Okay, Supervisor Bramer.
Thank you, Chairman. Is there anything that Jackie can report to us about the exit interviews, any trends, that kind of thing?
I would say that the number of exit interview forms I've received and completed this year are lower than they have been in the past. And I think that must partially be due to the fact that we weren't doing, in-person meetings, that we weren't on site. for a couple months out of the year. I have talked to a few larger departments who weren't quite clear on the process. So we've cleared up the process so that we're getting more forms and we're making sure that employees do have the opportunity, if they want, to have an exit interview. But the vast majority, as you can see in the second chart, maybe 20% of people elect to even do an exit interview. So it's something we're going to continue to offer, but a lot of people just are hesitant to participate or don't think it's a good use of their time. So we don't, we don't force the issue, but we like to offer it as an option for employees.
Is there anything, thanks Jackie, is there anything that you were able to glean from the exit interviews that you got or the few forms that you did receive?
Yeah, I get specific with each person about their particular job and their particular department. And I pass that feedback back to the department head. If there are concerns about, relationships with particular individuals, anything like that, I report those right back to the department head so that they can address those.
Was there anything on a bigger picture county level?
No, a lot of the people who've left, they're moving out of the area. They have a better opportunity. They found a job in their chosen field they went to school for. So nothing, nothing that I think would be alarming to the committee or that we as an employer need to be concerned about. It's all, everyone I've talked to this year, it's been, very personal reasons based on their life as a whole. It's not anything, I need to get out of Warren County.
Thank you.
Supervisor Seaver?
Thank you, Jackie. I think this information is really helpful and we'll be able to continue to see these monthly just to compare.
Yeah.
All right, great, thank you.
Is there anything more on that item? Okay, we'll move on to letter D, request to approve updates to the out-of-unit policies to include on-call pay for certain employees.
Sure. This change is actually as a result of a need in the IT department. So Mike Colvin's on if he would like to speak to the situation in his department.
Sure. It's always been if somebody gets called for overtime, it was observed that there was a minimum amount of overtime they got paid for if they got called after hours. When COVID came up, it kind of beat up my overtime budget. And as we look closer at things, we found out we really didn't have the documentation to support it because we always followed union rules if there wasn't a policy in place. But in this case, it wasn't the right thing to be doing. So we found that we needed to officially address that, in particular, I have people that work in the sheriff's office, they get called evenings and weekends, middle of the night. And if they're, might be working, 5-10 minutes, that they get paid a minimum like they do in the other unions. So we're looking to address that and make it official to pay them properly.
Okay, would someone like to move this to the floor?
Make that motion.
Supervisor Frazier, seconded by Supervisor Conover. Any discussion? Okay, we'll call the question. All those in favor? Aye. Opposed? Carried. Okay, we'll go to letter E, request to approve updates to the policy against harassment and discrimination.
Well, we're going to make it in alignment with the other policy that we adopted today, and then we'll take up the other suggestions.
Sure. This was the same change that Ryan discussed with the workplace workplace violence policy, where I've just added the same verbiage, and we can also put the time limit if everybody thinks that's appropriate. The exact same verbiage with reporting it in executive committee at personnel at the conclusion.
Someone like to move this to the floor? Supervisor Bramer, do we have a second? Supervisor McDevitt, any discussion? Call the question. All those in favor? Aye. Opposed? Carried. Okay, we will be, I received an email with other suggested. Excuse me?
I didn't mean to interrupt you.
Okay, other suggested changes by our county attorney that I haven't had a chance to go through. I think we need to take a look at them and then we'll bring them to the committee again for consideration. Okay, did you add something, Supervisor Kramer?
No, that's okay. I'm sorry for causing the interruption.
Okay, we'll move on to 3, referrals from the Criminal Justice Committee, assigned counsel. Request to amend the departmental table of organization and salary schedule to create and fill the position of grant manager, part-time hourly rate of $24.04, not to exceed $5,200 annually, and to delete the position of grant administrator, part-time hourly rate of $24.04, not to exceed $5,200 annually, effective September 21st, 2020. This position is to be completely funded by state grant monies. Supervisor McDevitt, you got a second? Supervisor Frazier. Any discussion? Call the question. All those in favor? Aye. Opposed? Carried. Letter B, request to amend the departmental table of organization and salary schedule to create and fill the position of clerk number 2, part-time, hourly rate of $13.19, effective September 21st, 2020. This position is to be completely funded by state grant monies. Moved by Supervisor Garrity, seconded by Supervisor Merlino. Any discussion? No, call the question. All those in favor? Aye. Opposed? Carried. Number 4, referral from the Health Services Committee, Public Health. Request to amend the departmental table of organization and salary schedule to create and fill the new position of registered professional nurse, number 40, grade 19, base annual salary of $47,523, effective September 21st, 2020. This position is to be completely funded by state grant monies. Supervisor Garrity, seconded by Supervisor McDevitt. Any discussions on that? Supervisor Conover.
Yeah, I just, my understanding is with these state and federally funded positions is that should the funding be terminated, funding for the position is terminated. In other words, that the position goes away unless the board acts otherwise. Is that correct, Ryan?
Yes, that's correct.
All right, thank you.
Supervisor Seaver.
Thank you. On that note that Supervisor Conover just brought up, I've asked a few times in different departments and looking at, when we're talking about budgets and these positions by grants, if employees are aware, if they take a position and it's grant funded, if the grant funding no longer exists, the position no longer exists. And I know that the Public Defender's Office has a form that their employees fill out. I'm hoping that it's kept on file with HR. Is this consistently done for any grant position so that, where those circumstances would arise? I mean, Jackie, is that something where consistently employees are acknowledging that they know if the grant funding disappears, the position disappears?
I'm sorry, can you repeat the question?
I've asked previously about employees who take positions under grant funding, and some departments have their employees sign a document acknowledging that if the grant funding goes away, the position goes away. Many times those employees also aren't subject to any type of increases or unless the grant provides that money for it as well, especially in the grants where there's no match. I'm wondering if every department follows the procedures of the Public Defender's Office where the employees actually sign acknowledgement recognizing the limitations of that position.
I'm not aware of each department, if each department does that. I don't know the answer to that, I'm sorry.
To me, it just seems like a best practice and maybe something that we could look into. certainly Marcy's had some good reasons in the past to have that practice implemented. But I do know I've heard from other department heads that they tell the employees, I just don't know if it's ever on in writing, and seems to me perhaps we should have things in writing.
We can find that out. I don't disagree. And if we don't, maybe we should.
Maybe we could just keep that as a pending item to update next month. Thank you.
Okay, is there anything further before I call the question? Okay, I'll call the question. All those in favor? Aye. Opposed, carried. Item number 5, referral from the Public Safety Committee to Sheriff. Request to amend the departmental table of organization and salary schedule to create and fill a new position of cook per diem, $18.82 per hour. Someone like to move this to the floor? Supervisor Frazier, do we have a second? Supervisor Molina. Okay, any discussion? Supervisor Bramer.
I saw some, sorry, let me back up. I see that there's crossed out the part-time. Can someone just explain what happened between the Criminal Justice Committee meeting and now with respect to that change, just so that we are clear?
I didn't have an opportunity to review the agenda. It was sent, the agenda for the public safety meeting. I get confused now because they're broken up, was sent without me reviewing it, and there was a typo in there. It should have said part-time. It should have said per diem instead of part-time, because that was the sheriff's intent in asking for the position. We ferreted that out afterwards with HR.
So just meaning that this person is only working, is there any practical differences between what?
There is. Jackie could probably explain more intelligently than I can.
Sure, thank you. The part-time employees are eligible for some benefits, some paid time off, where per diem employees work only as scheduled and get paid for their hours worked. It's not they're not eligible for any benefits.
Okay, thanks, Jackie.
Okay, I'll call the question. All those in favor? Aye. Opposed? Carried. Item number 6, referral from the Public Works Committee, DPW. Request to amend the departmental table of organization and salary schedule to create and fill the new position of construction specialist. Annual salary of $65,566, and delete the positions of environmental analyst, annual salary $41,974, and senior engineering technician, annual salary $39,502, effective October 1st, 2020. Someone like to bring this to the floor? Supervisor Marilino, we have a second. Supervisor Conover. We're ready for the question. I'll call it. All those in favor? Aye. Opposed? Carried. Item number 7, requests and items to be discussed by the county attorney. Update on pending litigation. Should it be? Okay, to do an update, it would require us to go into executive session to discuss litigation. We can. Good suggestion. We'll come back to 7. We'll go right to 8. Request from the clerk of the board. Request to renew the agreement with Glens Falls Hospital for morgue and laboratory services and authorize the chairman of the board to sign the letter of agreement provided by Glens Falls Hospital for same. The current agreement expires December 31st, 2020. This renewal agreement will commence January 1st, 2021, and will allow automatic annual renewals, provided there are no changes in the morgue use and laboratory fee schedule, as well as the ability for either party to terminate the agreement upon 30 days written notice. Any comment on that?
This agreement has saved us money over what we were paying in Albany. So we would like to renew it. I would note that when we come to finance, we are short in that budget code, so we need to transfer money. But I think we'd be doing a lot worse if we weren't using Glens Falls Hospital for these services.
Supervisor Garrity, do we have a second? Supervisor Merlino? Any discussions? All those in favor? Aye. Opposed, carried. We didn't have any, oh yeah,
Can I just make a note? Last month, there was a request for a report that would kind of track resolutions, just so that you know if they had been executed and how things were going. I just wanted to make a note, we are working on that, but it's gonna run a month behind, so you'll see the first report next month.
Thank you.
pending items, we had none. Positions authorized for filling by standing committee since last meeting. Here, the list is there and the explanations for details. Anybody have any questions on those? And I'm not seeing any. So with that, we will go back to item number 7, which we will need an executive session.
Formal actions.
We believe that they did.
Okay.
Amanda,
No, you don't have a motion.
we
They
didn't?
just, nope.
Okay. Can you, what are the 2 resolutions that we need, or do we do it all in one?
We do 2, one for the Medicare Advantage, and then one for the rest of the plans combined for the active employees.
Okay, so we would be, the motion then would be to authorize resolutions on both of those at the premium equivalent stated.
Correct.
I'll make that motion.
Supervisor Conover, do we have a second? Supervisor Garrity. We're ready for the question. All those in favor? Aye. Opposed, carried. Next, we need an executive session for an update on pending litigation. Seconded by Supervisor McDevitt. All those in favor? Aye. Opposed, carried. Okay, we're back into regular session. There is just an update on our litigation, current litigation, and no decisions were made, no actions were taken. So if there's, I'll check with Mr. Lehman to see if there is any public comment or anything related to Personnel Administration Committee.
Hello Supervisor Simpson. At this point, we do not have any public comments on our YouTube feed.
Okay, thank you, Mr. Lehman. Supervisor Conover?
Yeah, are you entertaining a motion to adjourn?
Yeah, I just want to make sure everybody had an opportunity. I saw Doug pop on for a second. I want to make sure he's had an opportunity if there's anything he wanted to weigh in on.
Well, when you're ready, I make a motion to adjourn.
We have a second. Supervisor McDevitt, all those in favor? Aye. Opposed? Carried. We're adjourned. Thank you.